Hey, it's Dr. C. Thank you for joining me again today. I'm going to talk about one of the biggest headaches with the U.S. healthcare system. And no matter where you read, you're always reading about some of the problems with the system. I was just starting my taxes for this coming year and looking at the cost of just to purchase the insurance for healthcare. It's gone up considerably, actually, from the last year. Oh, my God. And what are we getting for it? Well, that's a whole subject in itself. But I'm going to start this whole talk today about, number one, our failing U.S. healthcare system. And remember, the reason that all these different corporations or health equity groups and all are getting into the money from healthcare is actually that, the money. Healthcare pays out roughly about 18% of our whole gross national product. Right, 4.8 trillion back in 2023. Lord knows what it is now. Well, no wonder they're getting into it. They see big bucks, and they're taking big bucks from the system. I got a little thing here on a thing called the Commonwealth Fund. It's a nonprofit group that runs every year. They run a survey of how well all of the healthcare systems are doing in the world. But they especially look at the 10 highest, you might say the richest 10 nations in the world, and how's their healthcare system doing? And they rate them every year. Where do you think the U.S. is with that group of 10? Last. And with many reasons why. They're last along all of these different parameters that they looked at. They looked at the outcomes. Our outcomes are worse. They looked at deaths that could have been prevented. We're the worst. They look at the excess mortality, depending on whether it's infant or maternal or maybe even preventable deaths. Last. My God, it's amazing. And on top of that, a lot of them are preventable. That is amazing. And we're just sitting there doing not a damn thing about it. So let's go into one of the aspects that are really irritating, especially to me, but it should be for you too. And that is prior authorizations. Now, I don't know if you've had an opportunity to see what happens when you need a procedure or you need a particular medication and the doctor tells you, well, I have to get prior authorization in order for you to get that. Well, okay, why do you have to do that? Back when I was a kid, there wasn't no such thing as prior authorization. My God, we didn't even have health insurance, for God's sakes. Ever since then, though, now we have prior authorization, and each year there are more and more medications and procedures that fall under that category of needing prior authorization from the insurance company. It got to the point where a lot of people were looking at that, and the entrepreneurs were looking at it. They said, listen, we can do this. We can do this prior authorization for you. And so they approached the insurance companies. We can do it for you. And it won't hurt your bottom line. We'll guarantee that for every dollar you give us, you're going to make $3. Not a bad deal. 3 for 1. Of course, they don't say that on the, they don't tell anybody else that. But this is on the QT. They tell the insurance companies, we're going to make you money. Okay? So, we're going to look at some of these companies now that contract out to the insurance companies to do prior authorization. Now, first of all, we always define what the prior authorization, what it is. Well, it's basically a process by which the healthcare providers must request confirmation that an insurance provider will cover the cost of a procedure or a medication. Okay? Why did they start that? Well, the basic premise was that there's a lot of waste. Number one, there's a lot of dishonest doctors. They charge too much. They do too many procedures. Well, my God, why did I go into medicine in the first place? Not so I could charge extra money, etc. So that is a ridiculous premise. But there is a lot of waste in medicine. I must admit that. But it doesn't come usually from the doctor. Okay. But I didn't like that premise at all. So they started out, we're going to look at medications. So they call themselves pharmacy benefit corporations. They look at the pharmacy benefit to see if it is correct for the patient. And then they approve or deny. Now, that approval denial really came to fruition, you might say, and it came right to the top of the surface on the papers now because of the United Healthcare CEO that got murdered, shot in the back, got murdered. And then afterwards, they did a poll of people. Did you approve of this? 2/3 of them said no. But 1/3 said, listen, needed to be woken up. Woken up by shooting them in the back. And that is ridiculous. But that goes to show where we're at as a society right now. So I'm getting off the subject a little bit. Nevertheless, there's pharmacy benefit managers and also procedure benefit managers. And then there's companies that'll do both, procedure and medication management. Now, obviously, as somebody is successful, I don't care if it's medicine or whatever they're successful, there's a bigger fish who wants that company. And that is exactly what's happening. The companies are eating themselves up, getting bigger and bigger and bigger. And as they get bigger, they're more difficult to fight. Now you say, well, what does that have to do with me? Well, let me tell you a little bit about the most successful of all of the benefit managers out there. Remember, they contract with the insurer, and they will give them the authorization. They will do the authorization. The biggest one out there is called Epicor. Epicor by Evernorth. Much, much bigger than all the others. All of the major insurers in Massachusetts, including Blue Cross Blue Shield, Aetna, Cigna, all of the major insurers all use Epicor. Yes, Epicor. E-V-I-C-O-R, Epicor, to do their prior authorization. Now, Evicor started out, I believe, back in 1992. They were a utilization review company. They were successful. By that, I mean they were making money. And then they joined another group. And Evicor then was doing just procedure benefits management. And the other company was doing pharmacy benefit management. They were so successful that a place called Express bought them out. They bought them out. That was back in, let's see, 2017, I believe. Express Scripts bought them out. They too were very successful. And the year later, in 2018, Cigna, the big insurance company, bought them all out. But they still operate independently. And they still do the procedure and the pharmacy benefit managing. How does that work? Let's say that you go in to see your doctor now, and doctor tells you you need a medication, but it's very expensive. But it's a very good one for what your problem is. And it might save you surgery in the future. So what they have to do first is they have to fill out a double-sided form. And that form has to be filled out properly. It would take me, if I didn't know the patient, and most of the time, the doctors hand us over to somebody, either to a physician assistant or a secretary or something. Here, fill this out for me. Get that sent in. This is an authorization form. Well, it'll probably take that secretary, whatever, a good hour to fill that thing out. And that secretary or assistant has no idea who you are or what the real problems are and how it relates to you. So that thing gets sent in, usually electronically, to the insurance company. The insurance company hands it over to Evicor. Evicor is based, that first step that Evicor takes is based on artificial intelligence. Yes, a robot, no thought process there, and that robot works with an algorithm. If this happens, then you do this. If that happens, then you do this. It's an algorithm. They follow it down. And based on that initial review, you might say, by artificial intelligence, they will either approve or deny. Now, roughly about 40% or so are approved. They're usually the lesser charging procedures. But there's a number of people who are denied based on the material that's put down on that form. In fact, that's one of the reasons for denial. You didn't tell me enough information, can't make a decision. Denied. Oh, okay. And so then they give a call to the patient, this is denied. No explanation, it's denied. But you still have an appeal process. Okay, resubmit it. This is one of the deals that the hospitals and the physicians complain about. The man hours, the amount of money spent filling out all this crap with the form and all, going through everything to get a procedure or a medication approved. It cost billions. I think there was something like $2.1 billion in 2023 spent by the hospitals and doctors because of this ridiculous form and the appeal process, and trying to get money to get it approved. Okay, so let's go on. That's still just the first step. That system with that first step has been called by many of the people in the industry the dial. Why do they say it's called the dial? Because you can dial it up, denying more people, or dial it down, not denying many people. So it's not one person the same thing each time. You can dial it up and dial it down. Again, no person involved. Now the insurers say, well, yeah, but the material that went into that was all from peer-reviewed articles on that particular subject or that particular medication, whatever, and specialty societies that deal with that particular disease or whatever. But that should be updated every year. And when people have reviewed this, like when federal committees have reviewed this, they found, no, it's not updated. In fact, it's way below what it should be for criteria in that day and age. So, that is, as I said, step one, the dial. Step two, it goes over to a committee. And that committee is usually physicians and nurse practitioners. And they have to make a decision, and generally they need more information. So another form goes in, and another decision is made. It's interesting that of the people who get denied, that roughly about 40% of them on appeal will get it approved. 40%, that's a big percentage. But that goes to show how inaccurate that first dial mechanism is. There are some states like California who won't allow a denial, won't allow a denial based only on artificial intelligence and algorithms. They won't do that in Massachusetts, I'm sure. We're progressive. Yes. Okay. So, what are some of the reasons why, some of the reasons that are given why they deny claims? Well, first of all, the cost. No, this is much, much too expensive. There are alternatives that are less expensive. Yeah, less expensive, but are they as efficient or as good as the treatment that was asked for? Didn't say that, it just said cost. That's one. Medical necessity. No, that's not necessary. That's not medically necessary. It's cosmetic. That's a very favorite. No, that procedure's cosmetic. What? Or that procedure's experimental. What? Loads of different reasons based on medical necessity. That's the second reason for denial. The third, administrative errors. They didn't fill out the form properly. They didn't give you any information to make a decision on it. Administrative error. That's number three. Procedural error. They didn't do it the right way. Or maybe they did the procedure already and now they're retrospectively going to get it approved. All these are procedural errors. That's a problem. The next one, the fifth one. This requires multiple approvals because it may involve several different departments or whatever. You can't just do it with one department. You have to get approval of each of those. So multiple departments involved. That's the next one. The sixth one, you haven't tried a procedure before, a lesser procedure. You got to have that done first, or try a medication. Did you try that? If you didn't, you can't get this one. Of course, it's the cost. You know that. But that's another reason for denying. Another one, if it's a medication, it's non-formulary. Who made up the formulary? Nope, ours is non-formulary. You should know better. Oh, okay, that's another reason. It's a pre-existing condition. Now, pre-existing conditions are not supposed to be a reason for denial. But if you don't tell somebody on that form that you've had that previous condition, they won't cover it. That's another reason. So all of those things are reasons for denial. But in the good sense, you can appeal that decision too. People then have to even get a lawyer to help out. That's never cheap. Never cheap. And that delays treatment, of course. Treatment is delayed all along this whole process. They're supposed to be able to give you some type of decision of approval or denial within a reasonable number of days, say 3, 4, 5 days. This is going to drag it out, sometimes a month, 2 months. By that time, patient could be dead. In fact, some people have died without the procedure. Now, when that happens, who's liable? Who's liable? It is very difficult to sue an insurance company or Evacor or whoever the prior authorization manager is. Very difficult to sue them. I don't know why. It shouldn't be. My idea is they should be liable. If they denied a procedure and the patient was injured as a result, that to me is cause and effect. But what do I know? What do I know? So that doesn't mean that you can't get a lawyer and go after them. People have. Very few, unfortunately, have won. So as a result of that, that is a big reason why these companies and all are making so much money. I think I mentioned to you Evacor in 2023 made $2.1 billion. Billion. 2.1 billion. Of course, they're the biggest. They're the biggest. But there are 4 or 5 other smaller ones, all of whom have experienced problems via their denial process. But almost all of them have wound up in court. But very few have to suffer the consequences of that suit, nevertheless. So let's go on a little bit more. Let's again deal with Evacor, because they, like I said, they're the biggest. When they contract with an insurance company, there may be a standard contract. We'll do it for a year for you. Also, they have risk contracts. Let's say you're going and they're going to do a procedural benefit package for you. Say the year before you spent 10 million because of that one procedure your insurance had to pay out. They will come in and say, we'll reduce that by 10%. So instead of 10 million, it'll cost you only 9 million. And then we can share the million extra that you made that year. That's called a risk contract. So there are risk contracts out there. Again, it stinks, totally stinks. You can't find out the number of risk contracts that are out there. Not readily available. Not readily available. Roughly an average of 15% of all of the form requests, 15% wind up with denials. 15% on an average. Could be higher, could be lower. Like I said, they can dial it either way. So this is one of the reasons that increases the cost of health care in the United States. And like I said, it stinks. So what can we do about it? Well, legislation. You need to have the support of the legislators. And who's paying those legislators? I looked up. One company, here's just one company. United Health, the biggest one, United Health. These are the political contributions done in 2024. And pages of them, pages. 2,500 here, 3,000 there, 5,000, 1,000. It all adds up to almost $1 million. That's one company. And they give it to not just the federal legislators, but also the state legislators and the committees. And so they don't keep their money totally in their own pocket. It is a total mess. Okay. Obviously, I'm very frustrated with this myself, but it is reality, and we have to all deal with it. This is Dr. C. Have a cold and nice day.